of last year's cases were among iTaukei. I just want to ask, why is this group being hit so hard? Is it being more iTaukei coming out because more iTaukei are coming out and getting tested?
That's most likely to be one of the reasons. The other reasons is we target a lot of community groups. Based by ethnic groups, we do a lot of targeted interventions, like it's just a practice in public health here in Fiji. But also, we're starting to recognize that in many of our key population groups, a lot of our populations that belong to these groups are actually people who are iTaukei, and therefore they're engaged in high-risk behavior. Why that is, we don't know. We don't have the data. We haven't had the research around any of that. But the good news is there's a lot of research being done now that should answer a number of these questions that we just don't have answers for. We don't have, to be honest, I don't think anyone can say for sure why the iTaukei population is actually impacted by HIV more than other population groups. But just to be clear, all population groups in this country are reporting significant increases in HIV. And so therefore, for us to say that it's just an infection that is impacting the iTaukei population would be a misguided understanding of the situation. And I think